Hey everybody, it's Dr. Fletcher. Let's talk about laboratory stewardship and radiology. What a crazy topic. Why radiology? For me, it started back in my first laboratory stewardship committee. One of my biggest physician champions was a radiologist. And it's interesting. In the end, radiology and laboratory, yeah, we're separate departments, but we have a lot in common. We both do diagnostic testing. Laboratory, we use reagents. Radiology, they use radiation. But we share a lot of common similarities. A lot of times, people who are misordering or using poor laboratory stewardship principles are also using poor radiology stewardship principles. And so we had a lot of crossover. In particular, one day I was talking to my radiologist colleagues, and I was kind of bemoaning the fact that we had too many D dimers being ordered. It was like everybody coming in the emergency room had a D dimer. And just, oh, by the way, they were having a problem. Everybody was ordering CT scans for pulmonary embolus. And I guess that's where we had the aha moment. Maybe there's something we can do together, and we could have a win for laboratory stewardship and also for radiology stewardship. So, specifically, what we decided to do was how can we improve the ordering patterns of D dimers that could also lead to the ordering patterns of CT scans for pulmonary embolus? By the way, for those of you who aren't real familiar with radiology, that particular CT scan is a really high dose of radiation. So, it's not just ordering an expensive test that's not necessary, but also exposing a patient to a really high amount of radiation. So, what did we do? I'm going to pull up a slide, and these are real slides. By the way, this project, as you'll see, I kind of had to go back and pull this out of the archives. This is something we did. You can see these screenshots are from 2015. What we decided to do from the laboratory perspective was let's look at the order detail for a D dimer. In our hospital, anybody could order a D dimer, and most of you probably know what a D dimer is, but it's a really old school test for inflammation, and it tends to be positive more often than not in just about all hospitalized patients. So it's not a very good screening test. But what would happen is people would order this D dimer to look for a coagulation or an inflammation marker that could suggest it was a pulmonary embolus, which is a blood clot in the lungs. And so if you order this test and it's high, which all patients usually are, it leads to this really expensive CT scan that also delivers a lot of radiation to a patient. So what we decided to do was change things a little bit in the laboratory stewardship world. And we said, you know what, when you order a D dimer moving forwards, as part of laboratory stewardship, we're going to ask you, is this D dimer being used to rule out a suspected pulmonary embolus? And the clinician can select yes or no. Um, the problem with this is, as I said, it's not a very sensitive or specific marker. And so it tends to generate a lot of these unnecessary D dimer orders that doesn't really play into any decision making on whether the patient should get the CT scan. There's actually another tool called the Wells criteria, and I won't get into that. And this is a laboratory stewardship video, not a internal medicine Wells criteria video. But real quick, the Wells criteria, back in, I think it was 2003, Dr. Wells was the primary author on a paper that came out in the New England Journal and said, you know what, D dimers aren't really the best test for pulmonary embolus. The best tool is actually a really simple list of 5 or 6 questions you can ask the patient. And depending on how they answer it, that's really a better screening tool for pulmonary embolus than the D dimer by itself. So what we decided to do with our radiologist colleagues was if you order the D dimer, you would have to select yes or no, this is or isn't being used for pulmonary embolus. What would happen from that in the laboratory order detail screen, it would then fire the Wells criteria. So you could not order your laboratory test, your D dimer, without going through and answering these really simple questions about pulmonary embolus called the Wells criteria. Depending on how the physician answered these questions based on their clinical findings, the laboratory order detail would then fire a informational pop-up, dirty word, any case calculating from the Wells criteria what was the percentage chance of having this pulmonary embolus. Maybe you could cancel the D dimer test. The other nice thing about this is, in this case, it was high probability. So in this case, you could stop doing the D dimer and just move straight to your pulmonary embolus scan. The opposite was also true. If it was really low probability, go ahead and do the D dimer, but you don't need your CT scan. So now all of a sudden, this laboratory stewardship initiative is giving information to clinicians to help them guide, do I need the laboratory test, yes or no? Do I need the CT scan test, yes or no? There's obviously a lot more to this project than what I could share with you here in just a couple of minutes, but my rationale for showing you this was to start kind of thinking outside of the box. Laboratory, we're not just in a silo. Obviously, there's a lot of interactions between us and other departments, and one of them is radiology. In the end, this project, we decreased D dimers. I want to say it was around 12%. Wasn't the biggest decrease, but it was still a win for laboratory. For radiology, we saw a 25% decrease in CT scans for pulmonary embolus. So a huge cost savings, but also keep in mind the radiation doses here were enormous. So we ended up having a big win for patient safety. Let me know what you think. Again, hopefully this example will let you kind of start to think more about radiology and where the partnerships are. Let me know if you've done any projects like this. Have you included the Wells criteria into your D-dimer orders? And also share with me. I'd love to hear if you've had any other successful projects partnering with radiology. Leave a post, comment, drop me an email. And as always, good luck on your laboratory stewardship initiative. Thanks.